A study done by the CDC right here in Atlanta shows autism is being diagnosed more often than in years past. 1 in 31 American kids are now diagnosed with it before the age of 8. Political reporter Doug Reardon is live tonight at the CDC along Clifton Road in Atlanta. And Doug, there is some disagreement here over why this is happening.
Right, there is, Blair. Well, the CDC, who did that study right behind us here, said that it's just a sign of progress. As doctors learn more about autism, they find it easier to diagnose, and that's why you're seeing the rise in those cases. But earlier today at a press conference back in Washington, D.C., Health Secretary Robert F. Kennedy Jr. actually completely disagreed with that. And keep in mind, the CDC is in his agency. He said it's more likely due to what he said were environmental factors, things like food, water, mold, and maybe even vaccines. On Wednesday, Health and Human Services Secretary Robert F. Kennedy Jr. announced autism diagnoses were on the rise in the U.S., now affecting 1 in 31 kids. Kennedy called it an epidemic.
This is a preventable disease. We know it's an environmental exposure. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism.
Kennedy directly contradicted the CDC study that made the findings by suggesting autism was environmental, maybe linked to mold, food additives, pesticides, or vaccines, he said. Georgia Tech researcher M.G. Finn, who studied and even engineered vaccines for years, says the research there is pretty clear.
Vaccines engage the immune system. Autism is not a disease of the immune system. That has absolutely nothing to do, proven by study after study, with vaccines and immunization.
The CDC study said more cases are being found because as the years go on and doctors learn more, it's easier to diagnose autism. Families in Georgia's autism community only want answers. Shelley Price has a teen with autism and is president of the group Central Georgia Autism.
I would say we are just better at identifying it and addressing it.
If federal officials are going to buckle down on finding an autism cause, she hopes they move in the right direction.
I worry when we kind of try to move backwards to try to figure that out when there's so much promising research on other things about, maternal development and fevers and environmental factors that certainly have had a much stronger correlation.
And Kennedy said over the next few weeks, his agency would be launching a number of studies to look into environmental causes of autism. He said he hopes to have an answer by September. We're in DeKalb County. Doug Reardon, Atlanta News First.